Okay, great. Hi, and welcome to our session on breaking silos, climate resilience for WASH. This has been exciting conversations, WASH through women's leadership. My name is Elizabeth Ntojira. I'm the Global Communications Director at AMREF Health Africa. I'm going to be leading this conversation today. The conversation is being recorded to ensure that all the learnings and key outputs out of this meeting are put and captured into the CV report. Your microphones should be on mute, but please feel free to interact by adding comments in the chat at any time within the Pathable platform. You can find the chat session on the Pathable page once again. It will be available just below the join button throughout the session. Please keep engaged, ask questions, post your comments, anything that you would like to mention in regards to this really powerful session on putting women at the fore in terms of water and sanitation. Please turn your camera on so we're able to meet each other, even if it's just online. I'm really honored to introduce our keynote speakers who will discuss with us the need to cooperate for the access of clean drinking water, sanitation, and hygiene for healthy communities worldwide. We will delve deeper into topics of suburban areas in Africa, female leadership for water, and on climate resilient solutions with an impeccable panel, which includes Katerina de Albuquerque, who's the CEO of Sanitation and Water for All, Dr. Githinji Gitahi, who's the Global CEO for AMREF Health Africa, Margaret Kilonzo, a very vibrant and amazing community health worker from Kenya, the former Prime Minister of Senegal, Aminata Touré, who has been interviewed beforehand to make sure her powerful message resonates and is heard loud and clear, and will be able to bring that those sentiments to the forum. And last but certainly not the least, Henk Ovink, the Special Envoy for International Water Affairs, who will reflect to this session's call to action. Now, before we start this off, I want us to feel energized. I want us to feel open. It's a very genuine conversation around water and sanitation and the role female leadership plays to this. So I want us to start with a quick quiz. Let me see how many people know about this. And the question is, how many female ministers of health does Africa have? I hope you can switch on your cameras, please, so we are able to see. And the instructions include, if you think it's 10, I hope you have something blue with you and something red with you. If you do, then I would need you to switch on your video. If you think it's 10, please put the blue. It could be a pen, it could be your shirt, could be blue hair. If you feel it's red, 15, you could put, whether it's your lipstick, point at it, if it's your red top, if it's your red hair, if it's your red pencil, please just show us by just switching on your camera and showing us, because the role of women in health is extremely important, and we want to get from you how many female ministers of health does Africa have. Do you think it's 10? If you think it's 10, please showcase your blue. For me, I'm holding my spectacle wipe. If you think it's red, I'm holding my lipstick. You could let us know. So for red, it's 15. For 10, it's blue. I'll give you 30 seconds to let us know. I think the host can show us. Let me see if I do side-by-side gallery. Oh, fantastic. Wow. I see lots and lots of blue. I see a red notebook. I see something margarine that's blue, a card that's blue. Oh, wow. I feel like blue is kind of winning. Any more? Let me see on the next page of anyone who has turned on. I see a red business card. I see a blue towel. Oh, you guys are awesome. You completely nailed this game. Yes, so if you still haven't, very quickly on the poll. 10 seconds. I feel like the blue is winning, kind of. I don't know, Katerina, what you think. Would you like to share with us the correct answer, and also tell us more about why it matters to have women in such important leadership positions? Katerina, over to you. Sorry, Katerina, you're on mute.
Yes, I was on mute. Thank you so much. Thank you so much. And of course, the answer is blue because we have more than 10 countries, right? Of course, unfortunately, not yet more than, I have an echo, not yet more than 15 that have female leaders. So, for example, we have this in Uganda, in Tanzania, in Eritrea, and in Ethiopia, which is good. We can still grow. We still have space to grow. Including and amplifying women's voices at the highest levels of government is very important for multiple reasons. As a matter of equality, it's long past time that we see more women in decision-making positions. I think we all agree. As a matter of sustainability, having the voices of more than half of the population involved in how laws, how strategies, plans, and programs are designed and delivered simply makes good sense. With the COVID-19 pandemic, we have seen the critical intersection of health, gender inequalities, lack of access to water, sanitation, and hygiene. It's women health workers who have been on the front lines of this pandemic. In developing countries, many of them are working in health facilities with inadequate access to water, sanitation, and hygiene. Unsurprisingly, women have shouldered the lion's share of caregiving responsibilities when their family and community members have become sick, whether with COVID or other ailments during this period. Moreover, the reality of climate change is exacerbating these inequalities. We all know that. Climate change often means there is either no water or more water than we can handle. For instance, with water scarcity, women and girls are traveling even further distances to secure water, or they are forced to feed their families with water, which will make them sick. As we endeavor to build societies that are more prepared to respond to both public health and climate threats, ensuring the full participation of women. And when I say full participation, I mean also giving women the possibility to influence, real opportunities to influence decision-making. So it's indispensable, but it's also a matter of basic human rights. I'm excited, I'm very excited for today's discussions because we will have the opportunity to dive in deeper to the ways in which these various topics are connected. Health, climate, gender, and of course, water, sanitation, and hygiene. I hope that by the end of the session, we will all come away with the understanding that we must do more to recognize these connections and as a result, develop better, more integrated responses that will also be more sustainable. Thank you so much for your attention.
Oh, wow, Katerina, you have really captured all that spot on. And I could just feel, and I don't think it's just me, I think the entire audience could just feel your passion when you're talking about this particular topic. And I'm really excited that we're delving deeper, like you mentioned, into this. Now, before opening the floor to your wonderful questions that remember you can post on the chat function on the Pathable platform, we would like to first elaborate on a presentation with an illustrative video of water and women making a change with climate resilient wash solutions in rural communities like in the Afar region in Ethiopia. Enjoy this video. Worldwide, over 400 million people do not have access to clean drinking water. Polluted water causes diseases such as cholera, typhoid, and dysentery. Lack of access to clean water is exacerbated by climate change. In East Africa, drought leads to food shortage. Due to COVID-19, water became even more important. Girls and young women in East Africa are often responsible for the water supply. Ayesha from Haflu village in Ethiopia, for example, walks 6 kilometers a day in the search of clean water, time she could have spent at school. Besides, it is a physically demanding task. Together with governments and local communities, AMREF Health Africa works with its WASH program on sustainable solutions for lasting health change. In Haflu village, we decreased the water-related diseases by installing a solar power water supply scheme with clean running water. By investing in solar-powered water facilities, AMREF has realized both cost recovery and on sustainability. We trained local entrepreneurs to operate the solar water power plant and water points. In this way, they generate an income. Local health workers such as Fatima received a WASH training by AMREF.
ስለ ግል ስለ ቤተሰብና አካባቢ ንጽህና አሰልጥነውን እኛም ህብረተሰቡን በወር 3 ጊዜ እየሰበሰብን እናወያያለን። ስለ እጅ መታጠብ፣ ስለ ራሳቸውና ልጆቻቸው ንጽህና አጠባበቅ በባክቴሪያ እንዳይበከል።
AMREF also tackles hunger. Despite the extreme drought in Afar, the water dripping system makes agriculture possible. Next to that, women no longer need to walk long distances for clean water and have time to grow vegetables for an income.
ወደ 3000 ሰዎች ናቸው። ግን ውሃውን ከመሬት ውስጥ አውጥተን መጠኑን ስንለካ ለ10000 ሰው የሚበቃ ያክል በጣም ትልቅ ውሃ ነው ከመሬት ውስጥ ያወጣ ነው።
Together with governments and the local population, AMREF contributes to achieve that by 2030, everyone will have access to clean drinking water and sanitation. Sustainable Development Goal 6, a human right for all. Clean water allows girls to lead a healthy life to which they are entitled, and they can develop as students, local health workers, healthy educated mothers, employees, and even high-level decision makers. Wow, what a powerful video. They often say that a picture is worth 1,000 words. And today I'm going to coin something new and say a video is worth 1,000,000 words. Now, this is such a perfect example and great illustration of how WASH solar power plant scheme by AMREF Health Africa in Afar region in Ethiopia is making a positive impact within the community, with the community at the heart. Now, the floor is open to answer a couple of your questions that reflect on what Katarina said earlier. And I see there are quite a number of feedback and comments within the comment section, the chat section. We had also gotten a few questions beforehand, and I can see some comments saying, Katarina, people love your energy. They love the momentum and drive. I can see also a comment on the video, and yes, this video is available on YouTube, and we will share the link. I'll start off with a question to Katarina. We see often women as change makers in the community. How can politicians, NGOs, private sector help these women to make their work easier?
Oh my goodness. Well, they can make their work easier by creating an enabling environment that is favorable to women and to girls. Not only for women and girls that work on water and sanitation, but also for any woman and any girl who needs to get access to water, sanitation, and hygiene. So governments can pass laws. They can pass laws and policies and strategies and budgets, right? That support that enable access to water and sanitation and hygiene by women and girls. They can also, while they are preparing for such laws and regulations and policies, etc., they can and they should bring the voices of women and girls to hear from them firsthand what is the type of help that they need, what are the type of solutions that they need in order to be able to realize these rights. Also, another way to help them is to make sure that they come across good experiences and good practices in other countries, right? It's one of the things that we do at SWA. We do cross-learning events, matchmaking events, where we have people who have a doubt, a question, a request for help, and we put them together with others who have done it before. So we don't need to reinvent the wheel. Maybe I stop here.
Wow, that's really amazing, Katerina. Thank you so much. And now I will move over to introducing what we want to call the connector interviews. We'll witness 3 interviews on the importance of access to water for women leadership from the political, civil to the local level. Now we start with power woman Aminata Touré, former Prime Minister of Senegal, interviewed by Katerina de Albuquerque. This interview has been pre-recorded and is also available online. Remember, we will share all these links post this webinar session. Over to the conversation. Just a slight technical hitch, I think, but we are moving over to the conversation of Aminata Touré, a power woman, the former Prime Minister of Senegal, who was interviewed by Katerina.
Actuellement, un des leaders mondiaux de notre partenariat, de notre alliance Assainissement et eau pour tous. Vous êtes parfaitement conscient de l'importance de l'eau, de l'assainissement et de l'hygiène pour l'égalité entre hommes et femmes, ou entre femmes et hommes. Nous savons que les femmes et les filles sont les premières à devoir aller chercher de l'eau, à s'occuper des membres de leur famille qui sont malades à cause du manque d'eau, d'assainissement et d'hygiène. Nous savons aussi que c'est un sujet qui vous passionne particulièrement, que les filles sont empêchées d'aller à l'école à cause du manque de toilettes ou de toilettes séparées par genre. Dont nous entendons moins parler et dont je suis particulièrement intéressée de connaître votre opinion à ce sujet, c'est l'action, la participation, le leadership des femmes en matière d'eau et d'assainissement. Au niveau des ménages, les femmes sont les principales gestionnaires de l'eau. Elles ont des connaissances et une expertise précieuse sur la réalité de l'accès à l'eau et à l'assainissement dans leur communauté. Et pourtant, lorsqu'il s'agit de prendre des décisions au niveau national, les femmes sont rarement à la table des discussions, des négociations, de la prise de décision. Comment est-ce que vous expliquez cette déconnexion? Et dans votre opinion, est-ce que les choses seraient-elles différentes? Est-ce qu'on aurait un autre type de décision s'il y avait plus de femmes au poste des décisions, y compris, mais aussi au-delà de l'accès à l'eau et à l'assainissement?
Oui, tout à fait. Je pense que, comme nous en convenons tous, les inégalités de genre et les discriminations de genre traversent toute la société, toutes les sociétés du monde d'ailleurs. Et évidemment, il y a eu beaucoup de progrès quant à la représentation des femmes dans les sphères de décision. On ne le dit pas assez, mais peut-être les plus gros progrès ont été faits en Afrique. Le Sénégal est le 2e pays en termes de représentation des femmes au niveau de l'Assemblée nationale, l'équivalent du Parlement. Et cela peut changer la discussion parce que les femmes ont une expérience très, très, très pratique de ces questions. Comme vous avez eu à le dire, particulièrement en Afrique, la question de l'eau est une question essentiellement féminine. Ce ne sont pas les hommes qui vont aller chercher l'eau, ce sont les femmes dans les villages, parce que c'est elles qui auront en charge l'essentiel des tâches domestiques. Donc, il est évident qu'une femme qui arrive à un niveau de décision, on n'a pas besoin de lui expliquer beaucoup de choses en matière d'accès à l'eau, en matière d'hygiène. C'est pour cela qu'il est vraiment important qu'elle soit là où les décisions se prennent, au plus haut niveau, mais surtout à un niveau dont on ne discute pas beaucoup, c'est au niveau des municipalités et des conseils locaux. Parce que la question, c'est aussi une question locale. Et il est important que les instances de décision locales également prennent des décisions qui rejoindront celles de l'État central pour que ces questions liées à l'eau, à l'hygiène, puissent être à l'assainissement, puissent vraiment se retrouver au niveau des budgets locaux, mais aussi au niveau des budgets nationaux. Donc, à mon avis, il est vraiment important que les femmes soient au cœur des dispositifs de décision, mais aussi des dispositifs opérationnels. Par exemple, la gestion des forages d'eau. Il faut qu'elles jouent un rôle important, que les décisions soient prises avec elles, parce que je crois que c'est les meilleurs experts en eau, en réalité.
Je suis entièrement d'accord avec vous sur cet aspect. It is so unacceptable that we allow women's knowledge and expertise to be lost because of these discriminatory norms and practices. So beyond the lack of women in decision making, what other consequences can we see because of neglecting women's voices? And one of the things I am thinking about is women's roles in responding to climate change. So what do you think would be the first-hand information and the role that women could play in supporting countries to respond to climate change?
Oh, thank you. As the primary manager of water and sanitation at the household level, as I said, women are the first to see how all of this is changing due to climate-induced flooding or drought. They have to work longer kilometers and go through much more hardship over the years. So, as I said, they are really water experts, but they are also climate change experts because they live it, day by day. They are the one coping with consequences. Extra time is needed to access more distance safe water sources, adding to the burden of collecting water, carrying heavy weight. That usually fall on the shoulders of women and girls. They're the one dealing with the sick. They're the one dealing with food. They're the one, bringing water and making sure that the households just exist. So I think it's important that, they get represented, as I said, at strategic level, from the operational level, the community, the household, all the way to the top, and the very top too.
Thank you so much. So what are the promising approaches for addressing this interconnected challenges? As you know, at our partnership at Sanitation and Water for All, we bring different stakeholders around the table. And we have these approaches to raise the political visibility of water, sanitation and hygiene, and in turn influence its prioritization on the different agendas at a global level, at a national level, hoping that it will also foster action and prioritization, as you were saying, at the municipal level. In your experience, how do we come together to find collective solutions to ensure sustainable futures for all without discrimination?
Well, as we know it, in the development community, we tend to compartmentalize topics, climate, gender, water, education, etc. But that's not how people live their lives, right? I mean, that's the same person who would want to go to school, access to education, to water, etc. I mean, when you compartmentalize that, you make things even harder. So the same woman, as I say, is managing access to water, to sanitation, to health, to education for her and her family. It's also the woman who needs access to, accessible healthcare, nutrition, affordable food, decent work. Seeing how these issues are linked seems to me indispensable to building societies where women and girls can flourish, can live up to their dream, and can be, citizen in the full sense of the term. First, mobilize all the different stakeholders in the sector. I think it's important, but then make sure they connect and work together with their peer working in the other development areas. I think it's very important that we sort of achieve that way of working. Within the organization working in water, sanitation, and hygiene, we have been talking about the importance of participation and inclusion. This is central, to my mind, to multi-stakeholders approaches to ensure that there is collective deliberation, so to speak, from different actors within our societies and our communities. And I think that will be the best way to find workable policies, and that would help us move closer to delivering together, on the SDGs agenda. We also must ensure coordination across sectors. For instance, while we are still living in this pandemic, much of the focus now is on how to vaccinate and treat COVID, right? We have lost the crucial importance of prevention through hand washing and hygiene in general. And still, too many people, especially in the continent of Africa, still lack access to hand washing facilities, for instance. I don't see how we'll achieve the SDGs if we don't ensure this is how we operate. The SDGs text is very clear. All goals are integrated and indivisible. So are human rights too. Let's remember that. The SDGs and the 193 government that signed up for them were also very clear on the importance of tackling inequalities. Member states pledged to ensure no one will be left behind, no one. And to endeavor to reach the furthest behind first. I think that speaks to how we have to attend to the need of the most vulnerable and marginalized.
Thank you so much for this conversation.
Wow, what a beautiful, powerful conversation between two very amazing, engaging, powerful women within the sector, talking about why we need to take this conversation to the fore. Katerina, there's a burning question that has been posted that I think you can briefly answer. It's been posted by Jose Sluge Doyle. I hope I pronounced that properly. And it says, are you aware of examples where national governments have started to mainstream climate and gender into national WASH strategies that we could learn from?
From our side at SWA, we have been working with governments precisely to make it happen. Because one of the things that has been shocking us, very honestly, is how we all work in silos. And that's why this event, I think, is so important, because it breaks the silos, and then it brings the different sectors together. And one of the things that we are precisely doing at SWA is to bring the climate community together with the WASH community in order to infiltrate, like I like to say, infiltrate water, sanitation, and hygiene into the work on climate, and vice versa. And obviously one of the basic topics that we are not even basic topics. One of our basic guidelines and one of our basic principles is to encourage our partners to include gender. We have some examples, unfortunately not as many as I would like, from countries that are starting to do it. And we can, I understood that the person in question was called Jose. I didn't understand the rest of the name, but we can share, we have some examples for Africa, for Angola, for Guinea. So we have some examples. It's not ideal by any means.
Perfect. Thank you so much, Katerina, for that. And since you spoke about silos, I have another quick exercise and energizer for the entire audience. So if you could please switch on your cameras again. I hope you still have your blue and your red items with you. And, cooperation for water for all by including women is needed. So the question to you is, have you been able to break silos yourself as an individual audience member? Have you been able to break silos yourself? So yes, please showcase the blue. If it's yes for you, I don't know where my blue went, but there's a blue. thing here? And if no, please showcase with red. Waiting to see how that looks like. Please switch your cameras on so that I could see this. Let's see. So we have lots of blues, which is a good thing. I think the blues were breaking the silos, yes, and we still have a couple of reds. So we need to see what can be done to break those silos. So secondly, now we're going to move over to the conversation between Katarina and Amref Health Africa's Group CEO, Githinji Gitahi, who will interview each other. This will be really interesting to watch. Over to you, Katarina and Dr. Githinji.
I don't see.
Is Dr. Githinji on?
Hello, Katarina.
Yes, he is.
Katarina, I am here on audio. I am not able to join on video because I am looking for network in Nairobi and I can't find it.
Okay, but we only need your voice.
Let's hope this works, Katarina. How are you? And I'm loving the great energy. Let's get into this, Katarina.
Likewise, likewise. So great to be on this event together with you. I think that since we are supposed to interview each other right now, do you allow me to start, to provoke you?
Yeah, go. Yes, please. Go ahead, Katarina.
Right. So tell me something. Why do you think it's so important to ensure strong connections between health and water, sanitation and hygiene sectors? When we first met in Japan, you remember some years ago in Tokyo, this was our topic of discussion, health, but then also I remember also bringing the topics of water and sanitation and hygiene. So now, why do you think this is so important?
Well, because it's health, you know, water is life, Katarina, water is life. And I think if not many people know that a lot of health gains that have been made during the Millennium Development Goals and now the SDGs have actually had more to do with water and sanitation than the health sector itself. So if you want a strong community, a healthy community, then water and sanitation is a starting point, because then you're talking about healthy communities, not health care. Health care is what we do in the Ministry of Health, but water and sanitation is health. And we have seen during COVID that actually for us to be able to achieve good public health measures, we've had to invest in water and sanitation to reduce transmission and protect the health sector. Many people don't know that the UK, in their UK sanitation law of around 1918 or 1920, was the biggest contributor to the health development, reduction of disease and healthy populations in the UK. So water and sanitation is probably the biggest contributor to a healthy population and therefore the biggest investment that we need to make in universal health coverage.
Thank you.
And what do you think,
so
Katarina? What do you think about this issue?
Look, I could not agree more with you, of course. And like you were saying, these linkages were already there even before COVID. When we were preparing for the G20 in Japan, this was before COVID, right? And the links were very clear. The diarrheas, the choleras, the fact that half of hospital beds in Africa were occupied at a certain point with people suffering from waterborne diseases. So it's very clear. But sometimes I agree with you that these connections, that we are often blind to these connections, but we must make them again and again and again. And I think it's always interesting and to remind us of the economic costs of poor health that results from poor access to water, sanitation, and hygiene. If it's 1.3% of GDP globally, this is over $1 trillion, which is almost 5 times the GDP of my home country, Portugal. So making these links is important because everyone needs to understand that investing in WASH is, like you were saying, a question of life and death, sickness and health. childhood development or stagnation. And we cannot realize the human right to health without WASH, right?
Exactly, Katerina. And I think the question that I always ask is, when we measure health expenditure, when we say what is the nation's health expenditure, what is the government general health expenditure, we often count only the budget allocations, the Ministry of Health, from the government. We never count the investment in water and sanitation, which are actually water and sanitation. When we count our health expenditure, we must, Katerina, start to advocate for water and sanitation investment to be counted as health investment. Then we can make this conversation visible. But why do you think then it's so political? Why is it that water, hygiene, and the issue of women's health is so political, Katerina? And what do you suggest should be the way forward?
Well, Gigi, we have the technical know-how to provide water and sanitation to everyone. So the fact that we don't is obviously a matter of political priorities. Even in the richest countries of the world, there are people who lack access to water and sanitation, and these are always the same people, the people who are politically disenfranchised. And often we see that the rights, the needs and interests of women and girls seem not to be on top of political priorities. I remember very often talking with ministers about periods and menstruation, and this is all still a taboo. Why is it that in the 21st century girls still cannot go to school and women cannot go to work simply because there is a luxury tax on menstrual hygiene products and because there is period poverty, right? So I think that there is often a mismatch between long-term investment benefits of WASH, those that we are talking about right now, versus the short-term political cycles. So that is an issue that also from our side at SWA we're constantly confronted with. How do you see things, Gigi? The connection is not the best.
I see Gethenji was going to answer, but this is what technology does. It disappoints us at the most critical periods, but that was such an amazing conversation. I
hope you can hear me, Liz.
Yes, now we can hear you. We've lost you for a short while.
Okay, sorry, my network dropped and this technology, but I wanted to make a final point to Katarina's question, that until we have women in the boardroom, until we have women as policymakers, until we have women as health ministers, we will never resolve this issue, because men will not come to a time when they have periods so that they can understand the inconvenience of having to have periods without access to water and sanitation. So until that happens, that men can have periods, then we need to have women in the boardrooms as policymakers leading the health sector, because they understand critically the issues that affect women and girls with water and sanitation as a critical part of their lives. Thank you.
We agree, Gindiji. And it's about periods, but it's also about, and like Aminata Touche was saying, women are the ones who manage access to water inside the household, right? So they know how much they struggle in order to make sure that everyone gets access to the bare minimum of water and sanitation needed for their day-to-day lives, right? And for that, Gindiji, we need to mobilize political will, right? That's the way to do it. We need to have, like you were saying, the board members, the ministers, the prime ministers. We need to build a movement with strong participation of women that demands their rights, right? In particular, their right to health, the rights to water and sanitation, to make things move and to make things change.
Absolutely, absolutely. Thank you so much, Katerina and Dr. Gethenji, for that really engaging conversation. A best way to end it at
we must.
Sorry, Gethenji, we can't hear you, but that session has just slightly run out of time. And we really take cognizance of the amazing conversation that you've had, building a movement around ensuring that we have women in boards, that women issues are put to the fore. And I can see Valentina Riva on the chat is also agreeing to this. And now we move on to the next conversation, which will be Dr. Gethenji having an interview, sharing more key action points as he interviews Margaret Kilonzo, such a vibrant community health worker in Kenya who really works within the informal settlement areas, taking care of nearly 100 households, ensuring that people are well informed of what they need to do in regards to water and sanitation. I know technology is trying to let Gethenji down, but we know he's like an energizer bunny. He never says die. So he is chasing that network. And if he's not, Dr. Gethenji, can you hear me?
I can hear you. I'm on top of Nairobi's tallest building, KICC, trying to get network. I wish I could show you all where I am on top of the building. But here I am with Margaret now. And I really want to hear from Margaret. And I think, Margaret, Elizabeth has said you take care of 100 houses. I get the feeling that you actually take care of the whole of the Kibera slums, which is probably, 100,000 households, because your voice is bigger than the work you do on the ground. But how is it, Margaret, to be a female local health worker, locally where security may be a challenge, where there may be patriarchal systems, you may not have access to resources? And what is it that the government, politicians, and NGOs like ourselves can do to assist you? So you can take up all that, so that if my network fails me, at least we have the answer to all the questions. So over to you, Margaret.
Thank you so much, Dr. Gethenji. Thank you for inviting me today. Yes, being a woman is great, working in the community. I've been a community health worker for more than 20 years because of the passion I have for those people. They are my people. I was born there and raised there. So I understand the community very well. Being a woman in working in that community, it is great, because you find that the women are the ones who are relating directly to the family and the children. And without women, we can't reach the goals of people getting the right health, reducing the mortality rates and the morbidity. But you find sometimes even there is challenges in working in that community. Because for one, we are community health volunteers, and we have to balance between the family issues and also the work in the community. And being a part and parcel of us, we can't leave them. We have to go hand in hand with helping these people. So it's great to work as a woman. About the NGOs and the government, how they should help us, I think from my experience, I congratulate HAMREF, because for real, they have that capacity of helping the community, because there was a time they have provided that with water tanks, we managed to get clean water. They have also capacity built us so that we can get all the information concerning water in the community through mobile phones. And in fact, it has reduced a lot of time going to the class, needing paperwork. No, so they started that technology of learning through the mobile phones. And I know HAMREF has the capacity to help the community with clean water. So if government could network with the NGOs like HAMREF and make sure that we get enough of clean water, it could be very nice. Because you find that, especially this time of COVID-19, we need this water. And sometimes there are those climate changes whereby even getting this commodity water is very hard. And even getting money to buy that water, if at all you find it, it's very difficult, because you know the status of those people in that community. Getting money, it's a problem. But we thank AMREF for sure. They have never left us behind. They have been with us throughout. Since even I don't know when we started networking with AMREF. So if NGOs could come up like AMREF and assist the community, it could be very well. But AMREF has that capacity to help the community, and I thank them so much. Yeah, my wish is to see that everybody in that community gets clean and safe water provided by the government, networking with other organizations like AMREF. Thank you so much.
Oh, wow, such wonderful sentiments, Margaret Kilonzo. We really appreciate you. We applaud you, you and the fellow community health workers, because you are at the front line, and we thank you so much for your contribution on this. And thank you for those points, and we will continue working together. Now, Gethenji has encountered numerous problems, and I was smiling because he actually sent me a photo to showcase he's literally on top of a building trying to get the network. So I hope you can see it, but he says thumbs up for such an excellent job done by everybody else, by everyone else. I'm going to let Nanneke Nix, a program manager at AMREF, to just wind up on the key actions around this conversation with Margaret.
Yeah, so what we hear from all the speeches that we have heard from Aminata to the conversation between Katarina and Gethenji, and now also with Margaret, we can see that we need to make a movement. We need to build a movement. And that's actually what we want to call upon. So whomever is interested in joining us in making that movement to break those silos and to break the silence of women, we need women at the center stage. So please join us and send us an email in the chat. So what can we take as key actions? And I'm also going to welcome Henk Oving to reflect on these key actions. So what we think is most important is actually mainstreaming gender into WASH health and climate interventions. And what do we mean when talking about mainstreaming? Because it can also be an empty word, right? So you want women really to be included in decision-making processes. You really want their voices to be heard. You want to listen to them, and you want to make sure that they are enabled, capacitated to do this. And I have seen so many excellent women like Margaret who are doing this. It is a matter of enabling them and including them. And for that, of course, we need to do the community engagement. And as we are working in AMREF with the communities, that is actually what we see as what we can bring to the table as an NGO to give those communities that voice. But of course, we do need the other sectors. So we definitely need the different, how do you call this? I think constituencies, that's what it's called, Katarina. It's called constituencies of this sanitation and water for all to make things happen. We need different levels of participation to make it a reality. So that is what our call to action is. So Henk, if you feel you want to come in, please do.
Thank you, Nanneke. Thank you, Katarina, Elizabeth, Margaret, and all, either on top of a WASH facility or not somewhere in the world. This is of critical importance, but we also have to bridge a gap still. We lag behind. So it is not only to ensure that we mainstream gender into everything we do, and especially WASH, and I really like the words earlier, if we focus on the community, it's not about a sector because it is about all. But with that, that is not enough, because we have to overcome practices of the past that left women out and the most vulnerable out. So there is like something to really overtake and overcome. Gender equality and empowerment is, from the Netherlands government, as I'm a special envoy for the Dutch government, is a priority, an important priority, and a cross-cutting theme in all our development activities and advocacy. So it's in our policy, practice, but also in the way how we advocate. And I really want to make sure that that resonates, because from a political perspective, from a policy or government perspective, we too often limit ourselves to policies and regulations. But we have a role as politicians, as envoys and others, to also be the advocates, to do far better, to really leapfrog into that future where women and these gender issues are overcome. And not only because of the position of women and gender, because they lag behind when we really think about WASH. We know they have to walk miles every day, lacking the opportunity to really help their communities do better. We know from practice that women are far more entrepreneurial, far more responsible, far more progressive in the context of development, and they can spur their communities if only, there is access to safe drinking water and sanitation. So it's not only that there is a necessity from a gender perspective, there is a necessity and an opportunity from a development perspective. And we have many programs in the place, the Global Alliance for Green and Gender Action, for example, GAGA. It works with grassroots women organizations on climate resiliency, and it tries to turn hierarchy upside down by letting the grassroots groups decide on the distribution of funds, who gets what amount, and on the plans to be executed. So GAGA shows us it's possible, we put it in practice, but it also challenges to review our practice, not only show how we can do better, but also is provocative in that sense, giving us a mirror on how we can do better. From our perspective, from the political perspective, all the way down into our agency, promoting gender equality and empowerment of women and girls is our commitment. And as a co-chair of the United Nations 2023 Water Conference, we really want to make sure that this issue of gender and WASH and across the Sustainable Development Goals is not only mainstreamed, but forefronted as a message and a driving force in the preparation of that conference, and how we can, how inclusivity, I just came out of a session on the 2023, how inclusivity is not only a word, but is a verb, is meaning that we put it into practice, that it is leaving no one behind starts with women and girls. Promoting women's rights and gender equality, we aim for equal rights, opportunities and outcomes for women, men, girls and boys, but for inclusive, sustainable societies, women need to be actively informed. We know OECD monitors and many other that, and it's shockingly that in 2017, for example, only 0.05% of ODA was reaching women and their organizations directly. 0.05. Shame on us as a world. Not 0.1%. This measurement was repeated recently and the percentage has not increased. The Dutch Power of Women program has a budget of only 75 million for 5 years, and it aims to strengthen the capacity of women's rights organizations in the area of lobby and advocacy. It tries to strengthen women's leadership and women's participation in decision-making and political decision-making, and women's economic empowerment, improving the economic climate for women, preventing and eliminate sexual and gender-based violence. We need to give local grassroots organizations a stronger voice. I already mentioned GAGA, but there is definitely more working with grassroots organizations. Given the importance for SDG 6, WASH, in the context of the development goals, as well as 3, 5, and 13, health, gender, and climate, the Netherlands acknowledges the importance and provides dedicated funds for WASH. We've pledged to provide 50 million with access to safe sanitation and 30 people to safe sanitation. We recommend that all WASH programs include the promotion of gender equality and climate resiliency in the mix. We know and think and advocate that it is important that women's autonomy is strengthened. Having access to funds for WASH will recognize and support their specific experience, traditions, knowledge, and ideas, and ways to improve decisions and decision-making on water. But just as importantly, if women have decision-making power over funds, their decisions are far more likely to reflect women's needs and ideas. So they need to be in charge. And women know where the shoes pinch. It's not on us men. In the run-up to 2023, gender equality is one of our mainstreaming activities, and we will make sure to mobilize all the stakeholders, all the partners and coalitions to focus on programs and investments on achieving SDG 6 and the wider agenda, with gender equality as an indispensable role in this. The Netherlands acknowledges that access to sustainable and safe wash is a prerequisite for a healthy and dignified life, for socio-economic development and poverty reduction. Hand hygiene has proven to be a cheap first line of defense, but we also know that coming out of 1.5 years of COVID-19, a global campaign on wash, this pandemic is, where every prime minister, leader from civil society, the business world and investment said, wash your hands. We were not able to bridge that gap. If COVID was not a stark reminder on that gap and the need to take action, I don't know what it will be. We have our WASH programs like UNICEF and the WSSCC work with local community leaders and health workers, promote safe and climate resilient sanitation services for entire communities. We look forward in the preparation of 2023 to incorporate the outcomes of all these conversations, especially to gender and gender equality, into the preparations of the UN Water Conference in 2023. Now, that said, I want to thank all of you for your amazing work and dedication. Be sure you can count on us, but also call on us. We can always do much, much better as a global world, especially as I'm a man from the Netherlands, so definitely on the wrong side of history, you could say, but we want to make sure that we are on the right side of the future. Thank you for your amazing commitment and your fantastic work.
Oh, wow. Thank you so much, Henk Ovink, for that. Absolutely amazing. You've just succinctly put all the reflections and the call to action in a very amazing way. So we thank you so much. It resonates with all of us, and we're going to move forward, all of us together. So thank you so much to everyone, to all the panelists, to the audience, for all your contributions in this rich discussion. We've come, unfortunately, to the end of this discussion, but let's keep the conversation moving beyond this. I wish you a beautiful day and keep on breaking those silos together by connecting and working together. Thank you so much, everyone, and have a beautiful day.